All of our legislators for the HHS Oversight Committee are here. Legislator Bailey, Legislator Muldrow, Legislator Shea, and Legislator Winslow. I'd like to stand to allegiance to the flag. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, first up, hopefully you've all read minutes from our February 12th meeting. So I would entertain a motion in a second.
I'll move them. Second.
Any discussion? Hearing none, all in favor?
Aye.
Any opposed? Those carry. We have some appointments that we will review at the full legislative meeting. We have 2 people for the Community Services Board, 1 individual for the Alcohol and Substance Abuse Subcommittee and the Mental Health Subcommittee. So we'll get right into department updates, and I'm going to have Deborah Dennis, I believe you only had 1. Resolution for us, which is some bonus money with that to make available to a Little League team, and that is HH14.
Yes, with this resolution, we had awarded the Youth Advisory Board awarded funding to Southern Cayuga Little League. They had so much time to claim and utilize the funding. After exhausted efforts of reaching out to them, they never claimed the funding. So I got a amendment from New York State approved that we are allowed to reallocate that funding, but it has to be to a program that we had already awarded funding to in 2024. So we had already given extra funding to Booker T. Washington and Auburn lacrosse boosters. So the remainder of this funding, the 4,500, would go back to Northern Cayuga Little League. And that's what this is. The funding needs to be claimed back to New York State by March 31st of this year.
Can I have a motion for HH14?
I'll move.
Second. Any discussion or questions for Deborah?
Yeah.
Oh, I'm sorry.
Yeah, I think that's very surprised. It is disheartening that Southern Cayuga didn't get, I mean, we had exhaustive efforts on the voicemails and emails, and I had worked with Fred and Law to terminate that contract. We've never heard back with an email and a letter. I'm not sure what happened there, but I reached out to 3 different contacts with that organization to fill out the reimbursement forms, and they just did not come back to us in time.
No, I get it. So the money's going back to, is going to a program that you have, so it'll be Booker T. Washington and in the lacrosse.
We had extra funding already that we gave those programs. So the one youth team sports program that we hadn't given extra funding to was Northern Cayuga Little League.
Okay.
So since the other 2 had already received some extra funding we had by the state, this extra funding had to go to somebody we had already contracted with.
But Booker T. Washington is one of them, right? So I just need to know if I'm abstaining. That's what I'm previously. Are you giving?
Yeah, this had already passed the Booker, this passed back in June,
Right.
the Booker T portion of it, so you would be okay with this one.
Okay.
Any other questions? All in favor of HH14?
Aye.
Any opposed?
I didn't have, oh, I'm sorry.
Go ahead.
I didn't have much of an update this month, but I did want to let you know, I did speak with two of the organizations who did receive ARPA funding for us, and they are moving along. The Hideout Gaming Center, they're actually almost done with their phase of building and renovation. They're actually going to be moving to the Genesee Street Mall, and that should be coming along soon. They're doing the drywall now, so things are moving along very well with the Hideout. I know their original location was going to be at East Hill. That they ended up getting the space at the Genesee Mall, which works out better for them. And I think in the long run, it sounds like East Hill is going to be moving in the next couple of years. So I think that worked out well for them. Combat Recovery, they're also in full swing, so to speak, down. They're actually down by State Street. They're in the old Key Bank building there on the corner. And he's giving out about 20 scholarships right now. He's working with 2 incarcerated youth for programming, as well as working on an anti-bullying program, hopefully to get started this spring and summer. So those ARPA programs are going. Just wanted to give you an update on that.
Has any of those funds not been claimed?
They're all contracted, so that, we do have a contract with Growing Hope, with Southern Cayuga, Seymour Library, and, Cayuga Counseling. So we have a contract with them. They have until December of 2026 to spend that money. They just haven't claimed it yet, but they do know they have the funding.
Okay.
They just don't have anything to submit to me at this time, but they are all contracted.
And they're aware, they have.
Yeah, they're aware, Lynn's aware of it, and she's
Yeah.
moved that money
Okay.
forward and everything. Anything else?
All set?
All set?
Thank you very much.
Thank you.
So we'll move on to the health department for updates and resolution.
Would it be up here or right here?
You can sit with us. It's your choice.
I figure it'll be easier. People. Would you like to start with updates or resolutions?
Why don't we take care of resolutions?
I have 5 resolutions. Would you like me to go through them?
I can go through them for you. HH1 is authorizing the chair of the legislature and the public health department to enter into contracts with professional engineers for assistance with septic system and public water system approvals. And there's a special reason for that.
Yes, so I shared with Heidi some information. We have,
Should we move it, Fred?
Why don't we?
oh, sure, before discussion.
I'll move it.
I'll second.
Okay,
Thank you. We have within our environmental health division, 2 key employees who will be going out on temporary leave of absence within the next couple of months and through potentially through the end of the year. One of them being our professional engineer. We also just recently had a resignation that will take effect at the end of March of a public health engineer. So because we will be down staff during from April through December, we're looking to contract out some of the required work that mandates through the state and regulations that we have a professional engineer stamp off on approving it so that it meets all required, water regulations and septic regulations, et cetera. I could get more detailed, but that's the basics of it all. I've got some information about how much that's accomplished. We have an idea of how much things might cost, but it absolutely will vary. What we really want to have multiple contracts, both with individuals, ideally, as well as company, because we know that companies will likely cost more per hour for the work that we're looking for. Ani Fish, who's our Director of Environmental Health, put a great table together that not only identifies the required aspects that need to be done, a history of how much how much traditionally we have to do, and an anticipated time frame of what we could think would be associated with each type of plan review. So based on that information, we're anticipating approximately $30,000 would be spent toward contracting engineer work.
And should it exceed that, then you'd be sure to comply with.
We'll have to
our
come back.
contracted services, our professional services.
Absolutely. Yeah. And we'll be coming back to the legislature because we'll have to talk about moving money in our budget for that matter too.
Did you confirm that you had that money going into your point 4?
We do. In our contract line, we accepted in January, I believe it was, or maybe in February, some performance incentive money that we put into our professional, our contract line, professional services line.
I had asked Kathleen if you had planned for this, and she said, absolutely not, I didn't plan for this. So I said, how do you think you're going to be able to pay for this? And she said that luckily that performance enhancement money you accepted this year and put it into your point 4, and that's where this is going to be paid out of.
That's right.
And if you don't need more money for this service, your only thought would be you'd have to come back after that is expended, and then maybe transfer money from your salary line to accomplish it, because you're trying to do this within your own budget.
We are, and it's because of, salaried positions that, we are looking to do this work. So there will be some money that will be in our salary line unspent as a result of that.
Yep. Can I ask a question?
Yes.
Am I to understand that that chart there is a list of tasks that you normally perform that these engineering services would cover?
Correct.
We have the deficiency in staff.
They are. So it talks about, if there's backflow meters that need to be done, non-community water systems and or new ones or modifications, right? Because anything new or modified needs to be done. Community water systems, non-transient, non-community water systems. There's a whole bunch of details there. But,
And then, that's on the water side.
that's on the water side.
We have, the sewer side. Would that be like
Correct.
system design or requirement?
Exactly. So yes, that is correct.
Good question.
Can I ask a question?
Yes.
Tom,
Kathleen, I know as a resident, if you have to have a septic system built or put in, you have to have your own engineer has to come out and they have to design the system, put their stamp on it. Now, if this is a sewer system engineer person, what are they designing and doing?
What is the person you contracted as a
No,
consumer?
what's the person?
What is our staff member doing?
Yeah,
All right, so our staff member reviews those plans for accuracy to make sure they're in compliance with the state and local laws. Occasionally, there might be an engineer who's not familiar with the local laws, and we give the health department seal of approval to move forward to start to build. Because we are unique in Cayuga County in that we have more stringent septic system regulations in order to protect the watersheds than many counties do.
thank you.
It's the workshop.
It's the legislative.
Thank you. Couple things, I guess. So what the engineer is doing that we'd be hiring is and with Ron's question, they're approving what the design is, that what person's coming for.
Or letting them know what's not accurate, if you'd like. And this is, I asked Ani Fish to attend, she is our Director of Environmental Health. She's also a professional engineer, and she could speak to specifics of that.
And I guess I'm not questioning the need for that. I understand that, but
Sure.
I guess what I am gonna question is the way the resolution is worded and the way you're going about kind of just, to me, it sounds kind of a vague, open-ended ask. To go out and, now we want to go out and contract with professional engineers, not haphazardly, but, in no consistency.
I would agree with you that we don't have a plan yet for which engineering organization we're going to contract with, assuming we're able to, for which individuals. So we have, as you know, as most of you probably are aware, there is a list of engineers who are, that we share with people when they are looking to say, who could design a septic system, right? So we're going to be looking at that list of engineers and say, who are the people who rarely have issues in submitting their designs? They might be great that we could contract with. We're aware of other, companies that have engineering service. We're very specific as to the work that's going to be done by them. And it's only going to be that, that's requiring that technical expertise.
I guess the way that I'm thinking is, we have a purchasing director that I wonder if this would be better off if they were tasked with taking what is needed to be done, doing the description, and then
an RFP.
Like an RFP.
getting the RFP or something along that line.
I'll certainly consult with Amanda. I can tell you there's so much work that unless we want to pay a company only, I guess that's an option. Let me put it, that's an option. I do not imagine that there's any engineering firm who's begging for work. And I say because stuff is so time sensitive during this time period, we were thinking it would be easier even if we got, say we were lucky enough to get 4 individuals, maybe they want to do a little bit each, great. And then we'll just send our higher cost stuff that the individuals aren't going to pick up over to the engineering firm.
Is the concern there's just a $30,000 amount? There's no number of what we'll pay? I mean, is that?
Yeah, it just seems open-ended.
It says, let me spend $30,000.
We're gonna go out and hire engineers, and when we run out of that, we're gonna come back and ask more for more.
Yeah, so we will have to have contracts, and we did a little bit of research. Many individuals might be around $150 an hour. We anticipate that the companies are probably $250 or more an hour when we contract with them. Will we be identifying, until we have the designs, there's stuff we don't know that we're going to have to review until it's submitted to us. So I can't say affirmatively that July through December, we're going to have 45 designs of septic systems and et cetera.
Yeah, I guess that's not
You're gonna pay
really.
even. You have no idea what.
Because we have not
the
until we
number
got the okay.
The number of designs that you're gonna have to do, I understand that is unknown.
It's approximate, yeah.
But I guess what I'm looking at is,
What do we offer?
we had a known rate of what we were paying per time, is or so what I'm looking for.
I can certainly try to get some further information from what other engineering firms might offer us, because until we put a contract together, we got to see, we can say, oh, this one might charge us $350, this one might charge us $250, they're going to charge us $150.
We do this, Fred. I mean,
Well, the resolution anticipates that whatever the project is, that the health department will work with the purchasing agent, right, to develop whatever needs to be developed. That's in the resolution. So she does have to comply with the purchasing policy and the bidding requirements and things like that.
is it in there?
It's in the resolution.
Yeah,
So second to the last result.
Okay.
yes.
I'm not sure if that answers your question, Mr. Wynn.
I think he's looking for
Somewhat.
consistency.
I might not be understanding what you're asking specifically, and I'm
Not authorizing the amount that we're paying.
So any,
That's the issue.
per, right. There's no hourly rate that's being approved here. Nope, there's no project rate being approved here.
$30,000 and
You're right.
come back for more.
I
That's,
can say we're not handing $30,000 over to one agency and saying, do it all for us. But, right, we don't have that detail yet.
I guess, you have a scope of work that has to be done.
Right,
You should be able to have a ballpark, a good idea figure of what it's gonna cost for them to do that service.
Mhm.
And if it was more like, I know the number of services is unknown, but services at X amount per service.
right. Well, I can show you what I have here, which may be helpful for you and the questions you're asking. So here's the type of reviews, and here's the anticipated hours that it would take, right? The hours. And if we had this as a rate, then we've got some, this is the last 5 years. So she took an average of what we did over the last 5 years here. And so we were looking at particular types, but that's if we are fortunate enough to get that as our hourly rate.
Okay, and then I guess what I'm looking at is protecting the county's funds as far as, going to an engineering firm and they say, we know you gotta have that done. We can
Yeah.
go over the barrel. So we're gonna just jack up the meter.
That's why we want more than one option also. We don't want to have to go to just one place. We really want to look at 3 or 4 or 5 different contracts if we're fortunate enough to find that many who will be interested in performing this.
when do you think you'll need this?
We want to get people started now if they don't have experience as soon as possible, because the end of June
Prices,
is the latest, right? The end of June is then
right, but,
we are in immediate need at that point.
right.
But, yeah, I mean, again, if you're telling me to go out to bid, I don't know how long that's going to take to do, and that's going to waste a lot of precious time. We'll do it if that's what we have to do. If you want me just to call to get, this company said this company said this, I don't mind doing that. There's no guarantees when we finally have the contract that's because you're essentially asking me to contract at that point, and I don't have authority to do that. I can absolutely get prices of things, and I can try to call other engineers and start the work right now that I don't have permission to contract with yet.
And to Kathleen, I'll just, go ahead.
Legislator Strong had his arm up first and then.
I guess my concern, Kathleen, is that it's always on the onus of the individuals, be it a professional company or a regular citizen, either building a sewer system for his new house or having to have a new one put in, or if it's a commercial building, it's always on the onus of those people that they have to design, provide and design, or have an engineer design a septic or a water system for that particular project. So this person is going to be a higher educated individual than the contractor or the engineer. So, I mean, if you got somebody lower grade trying to just tell a guy that's got a higher education in engineering and designing the thing, I'm a little lost here.
So it's actually not. We're looking for an engineer to review another engineer's work. That's exactly the same. So the person who has to design it is an engineer and the person who's reviewing it is also an engineer.
Well, I guess I mean, the county should have a set of standards for their water or their septic system, because if we have special issues, then when the person applies for the permit to do the work, you hand them the standard and said, this is what the engineer, this is what you have to have.
Right.
To me,
We do
it's
that.
like we're hiring somebody to check somebody else's work. And
That is exactly what we're doing. And we're doing
that
that
doesn't make
because
sense.
we absolutely have found that there are designs that are not in compliance.
But what I'm saying though is the county should have a set of standards. If you're saying we have
We do.
special issues here in the county, then there should be standards that must be met.
Yes.
And when somebody applies for that permit to do that work, be it commercial or home, those standards must be given to them, and the engineer has to, abide by those special requests when they design their system.
Correct.
I mean, these people, I find it we're hiring a professional to check another professional's work, and it doesn't make sense to me. It's not money
It's
well spent.
protecting the county essentially and making sure that the laws are being followed.
Legislator.
Thank you, Madam Chair. If I'm understanding this correctly, as Legislator Strong stated, individuals hire a professional engineer that's on the county's approved list to design a septic system. They submit that to your office. Another professional engineer from your office checks for compliance to make sure it's following the laws of Cayuga County, because Cayuga County has specific laws that are different from other counties that professional engineers may at times make slip ups. I know from my time in Sterling, on more than one occasion, there were septic plans that were presented that did not apply, did not qualify or follow the county laws, and they were rejected and had to be resubmitted.
Yes.
That was caught by professional engineers in the department. So you're basically describing a compliance officer to make sure that the local laws are being followed, and it's an oversight, same as a police officer sitting on the side of the road checking speed limits to make sure people are following the laws. That's my interpretation. Now, with that said, you have staff members currently that are doing that job. One's going on maternity leave and another one's on a leave of absence. Is that
Correct.
fair?
Yes.
So you have this gap in space where folks aren't going to be there to do the compliance job, so you're looking to contract that out. Is that my understanding? Okay. So with that said, to Mr. Winslow's point, and I don't sit on the committee, they can, it's their decision. If this was to move forward, my suggestion would be to get with Amanda O'Grady prior to the next lunch meeting and have her make the calls and have her get out there. You have a scope of work that you've established. Have her go out and look and see if she get quotes off that scope of work to give the legislature an idea of what the actual cost would be per job or what the lowest rate would be per job, given the scope of work prior to the next meeting. I think would be appropriate, from what I'm hearing from the committee as well.
That's.
Yeah, so if you.
And put the rates in the
Put the
resolution.
rates in the resolution, correct.
And we can do that, but it may tie our hands to who we can contract with. Because you're going to charge me something, then what you're going to charge me, then what,
No.
John Smith Company is going to charge me.
And I think the legislature's concerns is about, what I'm hearing is about the budget as well. So trying to find a ground that works for everybody, I think,
Right.
is what we're
I mean, I get, we can do it, that you may tie our hands to have to work with that particular place, one particular place.
Well, we can also get a scope of work or quotes, because you got the north part of the county, the county's long. And there might be vendors throughout the county, north, central, and south, potentially could get quotes from 3 different areas.
Oh, it would be wonderful. As many as we can get, we want.
No, I just understand.
Yeah.
I'm sorry.
I think,
Fred
had some.
So it's kind of,
Today.
so it's kind of playing off of everything that I'm hearing here. Remember that in the 25 budget, the county had approached the legislature and said, we need help from a attorney standpoint. The legislature was kind enough to put a pile of money in the .4 account so that we could secure the best attorneys we could when we had projects we needed. I think that's similar to what is being asked for by Ms. Cuddy at this point. The other thing is to pick up on what Jonathan said. There are at least 3 or 4, I'm looking at Ms. Fish over there, 3 or 4 projects that are ongoing that we need to have the county health department engineers respond to the information that is being submitted for water treatment facilities, public water system, and probably a subdivision. So I think that's part of what you're looking for, so there's no gap when these individuals, your employees are out. So that's all I wanted to add.
And Legislator Shea.
Thank you. I'm sure Kathleen has, kind of a budget already in hand with a previous year's work. Is that assessment? And where the money's coming out of her account, lower she gets the rate, the more she can do with the money she has at hand.
Right.
So and it's a trust but verify type of thing, and Kathleen's on the end of the verify type of, so I would support this.
Without any additions or.
Yeah,
I certainly will, I can start asking, just to your point. I absolutely don't mind doing that and trying to get some very specific.
Yeah, like I said, just looking to cover ourselves, that we're not exposing ourselves to being, that's a better word, taking advantage.
Raked over the coals. Yep, yep.
Legislator.
I concur with Legislator Shea says. It's, we put, this is not gonna, I mean, we're all budget conscious, but it's not gonna break the bank. And this is why we have department heads. So we trust them and we give them that ability to go ahead and make those type of decisions. Otherwise, we're gonna end up with bids and it could take a very long time. And then we also can end up with a person we don't want doing the project because they had the lowest bid, or a company doing the project because they had the lowest bid, which we don't want either. Because I don't know if it'll be a significant discount, but I would trust her guidance and we should move on.
And I shouldn't speak anymore, but I also want you to know that we have this dollar amount because Ani did check with the American Water Works Association and she got, here's what a typical, cost would be for an independent contractor. And we do have a sense of what one company charges, but we know there's multiple companies and we want to look at all of them. So we would know if we were getting an exorbitant something. Yeah.
No, but to that same point, you could always get multiple quotes from Amanda. We could put in there, instead of listing a specific number, we could put in not to exceed, and that gives you range for your companies as well. So even the fact that you look low quotes, high quotes, and then in between, you get your range.
That's fine. I'll do that. I mean, and yes, I'm bringing it to the table now so that we can get this done ASAP.
So now I'm confused with the resolution we just decided. Yeah,
They were going as is.
I'll definitely get you more information. I will. I'll give it because I can tell this is a concern to many of you.
okay, so maybe at least you could come and just.
Maybe you could pass it and I'll still get it to you. If you're in favor of it, go ahead and pass it and I'll still get you the information.
for me.
So I don't hear an amendment and I don't hear a motion to table. So
Here in early spring.
any other discussion? Right, so we'll bring it to vote. All in favor?
Aye.
Any opposed? Carries.
Thank you.
Authorization to Cayuga County Legislature and the Public Health Department to fill a women, infants, and children's competent professional authority position as a nutritionist. This is due to a resignation.
Correct.
I'll move it.
Second.
This resolution's our WIC grant. We do fund all of our positions through this, through this grant, we had a resignation. We'd like the flexibility because the position we have allows for one role or another. It's hard, it's very difficult to find nutritionists. The competent professional authority allows for someone who's got 6 credits of nutrition and the appropriate degrees to qualify as opposed to a higher level of nutrition credits. So gives us a little flexibility. It is the same cost. They're the same grade, the competent professional authority and the nutritionist.
I have a motion to put HH2.
A motion for discussion?
A second for discussion.
So any questions? Discussion.
Yes. I believe it's the third whereas, where it's referring to if the work funding goes away and the position will be reassessed for,
If the funding goes away, we'll probably have to close the program. So they, whatever, you know, and I base it, I think we say reassessed only in the fact that depending on the role, right? I harken back to when we closed home care, there was shifting of positions when you have to do
so
something
you'll
like
have to
that.
just look at it at that time and see what adjustments will have to be made.
Exactly.
Thank you.
Unfortunately, WIC has just met its 50th year.
It has. It has.
So far, it's one of those long-term programs.
It's a very in-demand program. Yeah,
This is federally funded.
it is. It's 100, well, nearly 100% federal funds. So we'll see.
Any other discussion? Hearing none, all in favor of HH2?
Aye.
Aye. Any opposed? Carried. HH3, authorizing the chair of the legislature, the public health director to enter into an intermunicipal agreement with Onondaga County Health Department for provision of the tuberculosis control program. Move it.
Second.
Thank you.
This is a contract that we try to have a contract all the time. We used to contract, years ago, we contracted with Onondaga County. Then we contracted with another entity in in Tompkins County. Those rates changed and we looked elsewhere to see who else has this expertise so that we could get a better rate. And Onondaga County Health Department has a very reasonable rate for what we are asking for this level of expertise. There's an infectious disease physician who works with us.
Questions, discussion? Hearing none, all in favor of HH3?
Aye.
Aye. Any opposed? HH3 carries. HH4 authorizes the public health director to purchase a vehicle for the health department.
I'll put a motion.
I'll second for discussion.
The health department has approximately 10 vehicles that we utilize for all our field work amongst our staff members. We did budget for an additional vehicle this year. We anticipate, but we'll defer to the motor pool to verify that when we receive a new vehicle, that there will be another one that will likely be taken off the road at that point in time. So this is a request to purchase a vehicle.
Any questions, discussion? It's a budgeted item, legislator.
Thank you, Nick. I understand these vehicles are partially reimbursed. What's the reimbursement rate on these vehicles?
We state aid. So because we're using them for programs that fall under our state aid reimbursement, when we make the purchase, we put our claim, if we make it the time of year, depends. It's either falling entirely covered under our base grant or 36% to the dollar if we exceeded our base grant.
So the base grant, just for vehicles, that's across the
It's
board.
correct. It's for staff and it's for program related products, instruments to do
Anticipate going over that?
our base grant.
Yes.
Every year we go over our base
So we're
grant.
looking at 36 cents.
Correct.
The car that comes off the road generally could be reassigned to another department that didn't have reimbursement or
Correct.
doesn't have to go to auction.
Absolutely.
Your point is you want someone to try to manage this, but you don't have that now,
I'm working on it.
right?
Also, Madam Chair, if I can interject.
Yes.
Also, potentially there are higher mileage cars in the county right now that instead of potentially these low mile cars, I looked at a few of them in the 40,000 mile range potentially. Even though they're high in years and low in miles, we have some other cars that are over 100,000 or have higher mileage. I'm looking to rotate them out and actually auction off some other cars, but it's actually, there's more to it than that because we can actually get a higher value for the cars with lower mileage. And potentially, we really should be rotating cars around differently, so we're not getting higher mileage. We replace, we're auctioning off the higher dollars, so we're not absorbing that full, the other 70 cents or 60 cents, 64 cents.
Your hope is a fleet manager somehow put into the motor pool to take
No, just for the
responsibility of
motor
this.
pool, not for a separate fleet manager, but for the motor pool and the highway department to have a little more oversight of vehicles per se. It's just for the efficiency of how, obviously DSS and health department gets reimbursement, other departments do not. So it's about using our reimbursement cars across the board. I think is it 2 or 3 years we have to keep a car that's reimbursed in your department?
It's at least 2 years. I would have to check if it's more.
So, there's a minimum time frame you think can roll them out and then you can move into other departments where that's what we're looking at now. So that was why the emails went out about cars.
Any other discussion, questions? All in favor of HH4? Aye. Opposed? HH5 is authorizing the Treasurer Director to carry out a budget modification in the WIC program budget.
I'll move it.
A second.
Thank you. So the way we accept our funding, whenever we need a budget modification for this WIC grant, we do come before the legislature to do so. We've had some vacancies, so we're taking some of the WIC salaries and the associated benefits and moving them into the professional services line so that we can contract out for temporary help as may be needed during those vacancies.
Any questions, discussion? Hearing none, all in favor?
Aye.
Any opposed? HH5 carries. And
That is the end of the health
that's
department.
I see.
Just have a few
Go
updates.
ahead with your update.
Okay, great. Thank you. I'll pass around a few things, speak to a few things, and March, just kind of an awareness, it's Nutrition Month. So we usually acknowledge our WIC staff and participants during that time. Our WIC office is holding an open house for participants and their partners, and they certainly would like it if any of our legislators are able to attend. I recognize that it conflicts with our Ways and Means meeting, but it is next week, March 18th, if you want to, that's for passing around. It's also Colon Cancer Awareness Month through the month of March, and the health department does participate in the cancer services program. It's a 3-county, it's us, Portland County, Tompkins County, and people who are uninsured or underinsured to get cancer screenings for breast cancer and colon cancer and cervical cancer are able to work with us and receive those screenings. And then if there's more medical attention necessary, the individual helps facilitate linkage into more permanent healthcare. We're also having, you hear us talk about lead poisoning. I'm always talking about lead poisoning. There's always a lot of activity happening. As we're gearing up for the lead rental registry to go into effect later this year, it is anticipated. That's where there's a requirement that property owners, landlords have their homes inspected. There's a real benefit to property owners knowing how to properly repair their own homes if it does have lead paint. And one of the manner that you do that is by getting the lead safe renovation, repair, and painting certification. That is an EPA course. Our health department, through our prevention program, is hosting another, they call it the RRP, lead safe certification course. It is required that you register in advance for this. This is something that you would pay nearly $800 if you were paying out of pocket. So we really want to encourage people before the regulations take effect to get their certifications. Last week, I spent some time in Albany. It was, as all of you know, I'm a member of our, I've got six here. I'm a member of our state association for county health departments. And so we went and we spoke with various legislators at one point in time at the state level. Personally, I spoke with Senator May. I stopped at Assemblyman Barclay's office and Assemblyman Lamonde's and dropped off some information. But we also specifically had an opportunity to sit down. These places, the people that I was able to meet with were either the senators, assembly people, or their representatives. Senator Chris May, he's on the health committee. Assembly person Jen Lunsford, she has a real interest in early intervention issues. We did have a meeting with the executive chamber personnel, Craig Alfred and Erin Kate Licia. She's an attorney with the governor's staff. They talked about a number of issues related to public health. Senator Gustavo Rivera, who's chair of the health committee on the Senate side, and Assemblywoman Amy Paulin's office, who's the chair on the assembly person side. What I handed to you are talking points that we shared with their staff. I think it's helpful for all of you to be aware of not only that we're looking and advocating for additional Article 6 state aid funding. That's only going to help health departments if that is able to,
That's right.
Back in 2019 is when we got permission to put up to 50% of our benefits against our state aid, which is really wonderful. It definitely helps on the local taxpayer. Then, we spoke about why investing in local health is an investment in our communities. You can see that a lot of discussion about early intervention. The EI hub is still not working well. And that is impacting providers and their payments, and it's impacting our staff and service coordinators because of the length of time it is taking to submit information. And on occasion, the information did not upload correctly from the previous system. It's an issue that continues to be worked on, but we were reinforcing that it's probably not the best choice of program that the state went with there. Strengthening safe drinking water enhancement, drinking water, it's top priority within our state. And then, of course, lead poisoning, as I mentioned. So you'll get to see different information that's on there. Now, we had a little bit of an update about how things are looking as far as requests through the state. I'll share a little more at Board of Health. We'll have a little bit more information about where things are at in the legislative process, and what's going on that we're aware of. Additionally, probably about 3 weeks ago, I went to present at the NISAC meeting. I was asked to present about Article 6 state aid. And there were 3 of us from health departments. It was really a good turnout. There were about 70 people who attended that session. The first part I led with, which was what is Article 6? What does it cover? What does it not cover? And what's how does it translate into money, right? Then the second person who spoke is a lawyer within a public health department. And she addressed public health laws and policies and how they help and move the needle on health of communities. And then the third person who spoke really completed the circle by saying, here's why investment in public health translates into dollars that typical person doesn't always think about, right? And for example, preventing chronic disease helps prevent hospitalizations, helps, kind of completing the circle, so to speak. Really excellent short PowerPoint presentation that she gave that I found very helpful, that I'm going to be sharing with our staff. I'd like to present it next month at the Health and Human Service Committee, because I think it's of benefit for people to understand, and it'll really segue well into what's being asked for us to bring to Ways and Means when we talk about our budgets. So it might kind of tie things together a little better. Talk about our open house. And one of the things, I guess, that's more just a point of interest, some of you might be familiar with this. I was familiar with the product, but I didn't think a heck of a lot about it. NISAC was in part sponsored by Philip Morris. And yes, it's the tobacco company. And they were talking about a product called Zyn. Some of you may know. We had discussion about this because, there's a way that, of course, Philip Morris wants to market things. And then there's the public health view, like, that's not good for people. Zyn they're pouches that people use it's tobacco-free nicotine. It's like a nicotine powder that a lot of people use, like chew. They're finding it's very attractive and it can be flavored at times for people. So there's an interest with younger people. While it might be evident if let's say a high schooler, it might be evident if something's in their mouth. What they're finding now is that some students are using Zyn and like putting it between their toes as like a performance enhancer when they're playing sports. So it really, spikes their heart rate and everything. And I bring it up more because I was like, I have a level of naivete, clearly, but then I was like, why would you want to do that? But, what we see in one place, it's like what happens in New York City was going to happen in our county, within weeks, if not at the same time. So I guess it's more of a for your awareness. There's no regulation, that outside of what students are allowed to have in school or not, but some of you work with younger people and you're out in the community. It's just something to be aware of.
ZYM,
ZYN as in Nancy.
It gives you that reaction in your mouth, but you can hide it in your toes.
Yep, and it'll soak in right through your skin and give you still your buzz.
Good for old.
It is not healthy for you. If there's any people.
I don't know, it's not healthy for your mouth either.
No, it's not healthy in any capacity in which you sit, right? Nicotine is not something that is inherently great for humans. Yes.
It's amazing.
So
I don't try it the first time.
Thank you. Any other questions or?
Thank you, Kathleen.
Right, thanks.
I'm gonna jump again on the schedule. We have one resolution from OFA. Following that, we have one resolution from mental health. So would you like to? And that is HH 13. Resolution first.
So this resolution, we have funding we have been receiving every year for our caregiver support program. And as part of that support, we offer a variety of different services to reduce the stress of caregivers. So what we're looking to do is add a licensed social worker to provide one-on-one counseling for the caregivers that have called our office and looking for assistance. And we have a very high expectation for this role, that they would work very closely with us. They would be able to go to individuals' house. They would be able to go on a very short notice. And someone who has a lot of experience working with caregiver situations. So this would be one more tool in our toolbox. We currently provide respite through a contract with Loretto, where an individual can stay there overnight for up to 5 nights. We have a contract for social adult daycare, where people can go 1 or 2 days a week to the day program. And then we have aides that we can put in the home to help give the caregiver a break. So this is adding one more tool to that toolbox of options, so that we found that the mental health issues kind of overwhelm suicidal potential is becoming more and more something that we're dealing with, and that's beyond the scope of our staff.
A motion? A second for HH 13?
I'll move it.
Second.
Any questions, discussion?
You've never done mental health an actual licensed social worker and delivered services to people. This is brand new.
Yes. Yes.
Hopefully you'll be able to find one.
Yes.
Yes.
Another question? Hearing none. All in favor of page 13?
I,
Aye. Any opposed?
Yeah. So I've got a bunch of things just to share with you. I want to remind everybody that we are doing our March for Meals project campaign, March 17th to the 21st. We have a number of vacant spots on our calendar for various people, like legislators, to come out and work with our volunteers to deliver meals or serve the food at our congregate sites here in Auburn. I'll tell you right now that you're neck and neck with the city. We have 2 county people and 2 city people who have volunteered. So if you want to have a little competition, here's your opportunity. We look for an hour or 2, depending on, we'll accommodate your schedule, whatever you need. But it's always fun to kind of meet the people that are benefiting from the program and just learn more about what we do every day when we're serving those meals, 65,000 meals a year. It's quite a process, so it's appreciated if you can come either here in Auburn or in your local community. We'll set you up with someone. So I also wanted to talk about, last time I had nothing really to talk about because we were planning so many things. For now, I have things to share with you. Our senior council put together. So this is the seniors that get together. They're members of the various clubs in the community. And they have started implementing an annual training for the community about just different issues and concerns that people have. So this year they're calling it Seniors Need to Know. We're going to hold it out at Bluefield. And we have a couple attorneys coming to do a 3-hour presentation on advanced planning, wills, trusts, all those good things that everybody should be considering and getting in place. So looking forward to having this. We haven't done one of these type of programs in a very long time. So we're overdue, and these attorneys have presented for us before and have done a great job. So that's coming up in May. And then we have scheduled our spring outreach. So we will be going to both Sterling, as far as you can go north, and then we're going to Summerhill this year, as far as we can go. As far as we can go south. And, this is where we give folks who live in these rural areas the opportunity to have a much shorter drive, much easier parking. And we send one of our health insurance counseling staff and one of our New York Connect staff out. And they're able to do quite a bit for individuals. We're actually getting to the point where some of these individuals come back fall and spring to see us again if they need to follow up on something. So it's really working out well. We continue to invite USDA and the veterans to join us if they wanted to mention that. I think that
Presentation, Brenda?
so this year, yes, thank you for asking. Yes, we're very fortunate this year. We're partnering with Brian Skank he's going to do a presentation on scams in both locations. And that's a huge need. He just did a presentation for us as staff as an in-service, along with Michelle Rivoli from the Cayuga Lake National Bank, and I think it was Jan, I don't remember her last name, apologize. They both came out and we had a nice presentation. And what was great about it is we get lots of training, national, federal, ARP, all this different state, local stuff. But to have local folks from the bank and the sheriff's office talking about what they're seeing and how they try to intervene, and really great material. And then they also did an in-service for the Boyle residents after they did our in-service. So we're just trying to get the word out there because the scams and frauds are just huge. Real problem. So I think that was all I had.
You have any questions?
All right. Goodness, all right. Appreciate it.
Lauren, we have a resolution. HH 15.
Yep.
And this is a bill.
Yeah, so I had previously asked for this position to be filled, but the resolution would have expired at the 25th of this month at the ledge meeting. And we actually have we had two very strong interviews, so I want to be able to offer that position without having to wait until the following month to have it go through that ledge meeting. So that's why I asked for it to be put on late, which I appreciate.
I have a motion for HH 15 on the floor.
I'll move it.
Second.
Any questions, any discussion? Nice to hear you have some candidates lined up.
Yeah, it's been very quiet up until recently, so I'm happy that they were very pleased with both of the interviews, so.
Well, hearing no other discussion, all in favor of HH 15? Any opposed? Carries.
Okay, just a few updates. I did, this was one of the resolutions I met with the personnel committee for, but there's a few others that are very similar to this that the resolution would have expired. So I'm going to bring those forward next month. There wasn't necessarily a rush to put those on late for this meeting. So I just want to give you a heads up. A few of those are therapist positions, and then there's also a contract therapist position that we talked about there too. So I just wanted to let you know that those are coming.
And you've had a difficult time getting applicants.
Yes, we do have two interested people currently, but there's some logistics to figure out. One is in the process of moving here back to Auburn from out of state. And then just kind of figuring out the other one. But we did get a resignation from one of our therapists yesterday. So we will be looking to fill some of those therapist positions as soon as we can. So we've done all the posting on all sorts of websites, and we've definitely gotten we've had more interviews recently than we had, like a year ago. But still, definitely not like flooding us with, resumes or applicants or anything like that. So hopefully we can fill those. I know I mentioned we are in the process of opening the harm reduction drop-in center at mental health. It looks like for the first 4 weeks, they're going to really be doing that by appointments, just to kind of get the word out there and also not overwhelm the staff. We kind of don't know what it's going to look like, so they want to do a kind of a slow opening. So that's going to be happening in the next couple of weeks. They're going to be open just a couple of days a week for appointments, so that will be starting. I'm very excited about that. I think it's definitely a need and something different than what we have now in our community. So does anybody have any questions about that?
I think I'm going to I better go to this.
No. So this is not a safe consumption site where you would come and use drugs there. No. Basically, it's a place for people who are in active use that may not be ready to stop or don't know where to go in order to stop their use, whether it's alcohol, drugs, it doesn't necessarily matter. There's no stipulation of using the harm reduction center as far as like you need to stop right now or else you can't use the services. So it's really about keeping people alive while they make decisions about their treatment. So there's going to be a peer that works out of the center. There's Narcan, testing strips, all of the safe use materials that they can come and get. They can also meet with that peer ongoing. So it's not a one-time deal. They can come back as many times as possible, but it's also like a wellness center too. Like they're taking donations for clothing. There's going to be food there. There's going to be classes that they're going to run out of there, like yoga classes and other things too. So it's really about forming like these relationships to hope that we can eventually, yes, help people stop using, but it's not a stipulation to come to the center, if that makes sense. And then we are in the process of working with the state of New York to develop a suicide prevention coalition. They have like a model and we're really trying to get that up and running. Because I did just see some of the data from last year. We did have 13 suicides in our county. And just so you guys know, 12 of them were males. And the average age is around 56, which is, it fits the exact criteria of where there's a higher percentage of somebody completing suicide. So I wanted to mention that we're really looking on forming a coalition to, we actively talk around education about prevention and education around suicide in general.
Did that before and
We did.
a standardized tool and all
Yes.
of that.
We did have that before. I'm not sure, it was before I was in this position. So we're really looking at getting that up and running. So Maureen's been kind of spearheading that with the state because they're really pushing that county should have that. So we want to get that started.
Schools and everything.
It's kind of like, it could be made up of all different types of people and I think it would meet regularly and we talk about different things that we can do and different service providers can do to hopefully prevent that. Yeah.
Is our suicide rate different than other?
I'm not sure about that. That would be a good thing to kind of look at. Historically, it has been higher. I know that. I'm not sure where it stands now in comparison, but I could do a little research on that.
Is 18, is that higher than what it was previous years?
I'm not sure. I can look. I just received that, so I
Under had you know that to be true, Kathleen, or you just?
No, I remember when Elaine mentioned, we looked at this in the past, this is something
It's
that
a huge issue for our community.
is,
Two.
and
Yep.
whatever source Lauren got it from is where she wants to go.
yeah, I mean, I got it from the coroner's office, so I can definitely follow up there to see, because they would have all the data from previous years. So I can definitely look at that.
It seems, I don't want to say unusual for lack of a better term, that age group is
That's.
committing suicide. Is there any consistent, driver of that? And I don't have the best choice of words, but
No, I think that has historically been the higher risk population and age over a long period of time. I also think men are more likely to use a lethal means of suicide than women are. So that is also a reason why sometimes they're more likely to use like a lethal means, like a gun or hanging versus women are more likely to overdose on pills. That's just how it's been over time. So I think that's part of the reason why there's a higher rate in men because they tend to use those types of things. Yeah. So I will do a little digging. I'm sure it won't be very hard for them to provide me with that information, but I can look and compare to previous years, but 13 is too many.
absolutely.
And if there's I don't know if you could find this out, but if there's a known history of mental illness or depression, or this came out of, you know what I mean?
Yeah, and and I don't know about previous years, but just knowing about some of these weren't necessarily people that were connected to any services.
Suffering in silence, maybe.
I'm digging into the weeds, but I'm curious as to why. And until we know why, it's hard to
Yep.
prevent.
Mhm. Yep.
For example, how many are married? How many are veterans? I know it seems to be a higher amount of veterans
Mhm.
as opposed to non-veterans.
Mhm.
So
That is true because of the PTSD.
maybe it could.
Yeah,
use that.
yeah, for sure,
PTSD.
for sure.
Thank you.
Mhm. On a positive note, our overdoses are trending lower than they were last year, so they are going down each and every year. We've also found that there's not necessarily as many people using heroin or opioids as there were. That's sort of shifting to more amphetamine use, and like things like Molly, more stimulant use too. So it's definitely, they're always changing as far as like but we have noticed that some of the deaths from overdoses are from fentanyl being laced in cocaine or crack, which is different. I think some people think they're sort of safe using those, but there is fentanyl in those drugs as well. So we're really pushing, Narcan isn't just for people that are using opioids, but it's really important to have that even if you may be using other drugs, because there is a high possibility that there could be fentanyl in there as well. So, yes, there's another thing. And then through our SAMHSA grant with, I've talked about the DBT in schools grant. There is like sort of another part to that I wanted to mention. We have a contract with New York State Families Together, which is a peer-run organization of people that either have lived experience or are family members of people that have people in their family that have mental health issues. And really the goal of contracting with them is, we have a parent partner that's on part of our, that we're contracted with right now. And they're going to be holding focus groups in all parts of the county. So I know they have, 2 scheduled already in Cato and Union Springs. I think they're looking, at the Sterling area as well to set up a focus group and really talk about, with families, like how has it been for you getting mental health services for you or for your children? Specifically children, because that's what the grant is around, but it's really about taking that information back and seeing how we can change the system to better serve children in our county.
I see in the sheriff's report, it says overdose numbers continue to track lower. Yep, you just said that. Mental health crisis calls for service remain concerning with a record number in January for our agency of 26. Of 26 calls, 21 individuals were transported to the hospital for treatment. To me, that meant there are really significant issues coming up that couldn't just be diverted by whatever you have in your.
Mobile crisis.
Yes.
Yeah, I mean, I do think mobile crisis, they have been busier lately. And they're doing some education around the Auburn Police Department too, because there's a lot of new officers there. So I think that would also increase referrals. But yeah, I mean, I think law enforcement really deals with a very high percentage of mental health calls. And our goal is that we should have a mental health professional there to go to those. So I don't know how many are happening in the overnight hours, because that's the only time that we don't have a mobile crisis team that's contracted. So that's from midnight to 6 a.m.
Could they've been diverted, who knows, but if.
Maybe.
Right, but they have to go for the facility.
Right. Right. But I'd have to talk more specifically with him to see, what time are those calls coming in? Has mobile crisis been not available, or what's kind of gotten in the way? But the goal is they can do an assessment so that law enforcement doesn't have to bring them to the hospital if it's not needed, because it's a waste of resources. Plus, the hospital is very overwhelmed in general in the emergency department. So
I guess I thought mobile crisis went and said you have to go, but.
Maybe.
Not necessarily.
But I don't think we're seeing that high of a percentage from our mobile crisis data. Is when the mobile crisis team does respond, I think we're seeing a lot higher of a percentage that they don't go to the hospital or they don't need to go.
Interesting.
So maybe there's some disconnect there, yeah.
Okay.
So I can talk to Brian about that a little bit more. And that's all I got. If anybody has any questions. All right, thank you.
Thank you.
Christine? Your resolutions as well, exists. The amendment to the Department of Social Services 2025 budget for Senate funds in New York State in the form of the Adoption and Legal Guardianship Incentive Program.
Yes. So this is,
Second.
so this is new for us. Basically, New York State receives funds based on certain performance measures and data that they pull, that the feds pull. And they look at the number of foster kids that are adopted, number of teenagers 9 to 13 that are adopted, and then 14 age and up that are adopted. And based on those numbers, they allocate certain funds to New York State. And this allocation that we receive is basically New York State reinvesting some of those funds they get from the feds back to the counties so that we can continue to work on some of the barriers and work to achieve adoptions for children that aren't able to return home to their birth parents. And to, break down some of the barriers especially for some of the kinship foster homes that we have, when it might be a surprising situation that presents itself to a relative and they need to do something in their home to get a bedroom ready. Sometimes they need to get like beds, things like that they would need to be able to take in that child and provide care for them. So this is some money that's coming our way that we can definitely use to assist families. So.
Any questions? Discussion?
How much is the incentive?
So we have $25,000 to use. And so it could be, that a family needs $500. It will be allocated based on like that specific family's need.
Mhm.
And also we can do some recruitment, you can utilize the money to help us with some recruitment efforts.
different things that we can, posters. We used to have like a really big sign. It got ripped apart by the wind when it was out on Genesee Street. We might be able to use it to buy another one of those posters to put up just to, kind of catch people's eye. Help them know that we continue to need foster homes, and how they can get in touch with us.
Any other questions? Hearing none, all in favor of HH6?
Aye.
Any opposed? HH7 is authorizing the Chair of the Ledge and the Commissioner of Social Services to enter into a contract with Cayuga County Mental Health for reports and assessments on the placement of a child in a qualified residential treatment program. A motion to that on the table.
Second.
Thank you.
So we're looking to enter into a 2-year contract for this year and for next year to, again, contract with Cayuga County Mental Health to provide these assessments by this qualified individual. This is something that we have to do. We don't have a choice. We have to identify a qualified individual and have them within very strict timelines do this evaluation on children that are in our QRTPs, which is the residential setting for foster children.
And I noticed that the language of your resolution includes and any other volunteer agency or that include also private practice?
So they're
Directed only.
hypothetically, I think there could be somebody. We haven't found anybody that is able to do it for us. That's a private practitioner. The only folks that we have used is Cayuga County Mental Health and also Cayuga Centers. And we've done probably approximately 15 in 1 year is the number that we do. It's a little bit higher than the number of kids that we have in residential because if a child has to move from one level to another, say they're placed at a regular level of a residential program, and based on their behavior, they need to jump up to the next, which is a hard to place level, more supervision, different components. We have to do another QI assessment.
Any questions, discussion for Christine? Hearing none, HH7?
Aye.
Aye. Any opposed? HHS is also entering into contract with Cayuga Community Health Network for transitional housing.
HH8.
I mean, HHH.
Yeah.
Move it.
Second.
Okay, so this is the transitional housing program through the Cayuga Health Network that we've had in place, and we're looking to renew this contract. They started with us in April 2024, taking placements. And just a little bit of background and numbers. I checked in with the Cayuga Health Network to find out how things have gone so far. Right now, we have 5 family apartment units that they're running, that they're taking referrals for, and 5 single, where it's a efficiency apartment. So one single person can be placed in those units. They had 28 referrals. That was the combination of the singles and the families. I don't have the breakdown on that. There are currently 3 families enrolled and 4 singles enrolled, so 7.
Not all coming from the jail,
No, so the singles are coming from the jail.
right?
And then if they're,
Your third floor and say I don't have.
correct, so some of them are jail, some of them are not.
Yep.
Do you place those people?
Pardon me?
When they come in and like they're either evicted or they come out of jail, do you find places for them? Like what's the percentage?
Hotels.
No, I know, but I mean, what's the percentage? Like, is it? like
If somebody,
10%? At some point, we run out of hotels.
if somebody's incarcerated and they don't have a place to go, I know that their transition coordinator works hard on trying to identify somebody, that might be willing to take them in or if they had to have a place to go back to. But oftentimes after incarceration, a period of incarceration, folks don't have a place to go and they do work with us. So sometimes folks come to us but the purpose of this program was really to help streamline people that were leaving incarceration to go to a place where they're going to have supervision. They were going to have somebody really helping work with them on, maybe there were benefits that they had received before they were incarcerated.
I just want to know if they're
Yeah.
likely to, you know, I didn't know what
Yeah,
the
there's-
percentage was. I didn't know.
There's a good number. So, but of the numbers that I was talking about, there was actually 21 who went through the program of the singles and the families combined. There were 21 referrals, and 16 of those did not complete the program due to noncompliance issues, rearrests, abandoning the apartment completely and just leaving, or active addiction issues that are against the program rules. There were 5 successful discharges from that program. 3 were families and 2 were singles. So there is a high number that are not actually making it through the program. I think that it does speak to just how complicated, some of these issues are that they need to deal with. But 5 successes is pretty good, I think, as far as, being a cost that, kind of how it impacts cost for the county. When you have a single that's housed through this program, it's $50 per unit for their unit per night. So that's less than a hotel stay. $100 per night for the families to stay there. Again, it's comparable with a hotel, but it comes with that case management and a lot of support to try to get them to move through. And even some of these unsuccessful discharges, there are things that the case management does for them while they're there to try to connect them to employment and, benefits that they might need, and supports for their mental health and their physical health and their children. So,
Well, a successful discharge, they went to another
yep,
apartment.
they found permanent housing. Permanent housing is the successful discharge from that program.
So they'll stay there as long as they need to.
Well, the time, we don't have as long as you need. It's supposed to be, ideally, it would be about 3 months, but there is some flex in that. So if it's looking like within another month, somebody would get an apartment, then yes, they can stay for another month. But I mean, this was the first go around that 11 months, not even, it's like 10 months that they've been working on this program. So trying to give, go through, we're asking for a contract for a 2-year timeframe of 25 through December, almost 2 years.
And they're the landlord on these apartments, which makes it easier for them to get the apartment, correct?
Yes, and the networking, I mean, I think, that is still something that I think is been somewhat successful, is Cayuga Community Health Network's relationship with the landlord helps to pave the way, I think, for folks that are doing a good job, that are, following the rules and are really kind of proving that, there's somebody that the landlord would want to rent one of their other units to. And, that was always our hope, that would help kind of, prove, right, that they were successful at, staying in this program with the supports, and that they, can move into an apartment and be successful and have their own apartment outside of the program or DSS support.
Any questions, discussions on this entering into contract? Hearing none, all in favor?
Aye.
Any opposed? Page 9 is authorizing the chair of the legislature and the Commissioner of Social Services to enter into a contract with Fort Hill Cemetery for the burial of indigent individuals.
What,
This is something that,
Second.
so this is a 2-year, goes through the end of 2027.
Yeah, 2-year contract with a cost of up to $975 per plot for folks that are determined to be without the resources. The deceased doesn't have resources to be able to meet the needs, for a burial.
Questions, discussion? Hearing none, all in favor?
Aye.
Any opposed? Page 10 is filling a caseworker vacancy in the child welfare unit.
Second.
Okay.
Like-
I'm asking for one, Phil, this month. The reason that the person left the position was because they didn't complete the probationary period successfully. Unfortunately, in addition to this, I'm going to be bringing in another resolution next month for 2 more caseworkers who recently resigned, from DSS to take jobs at Cayuga County Probation Department as probation officers. We had one that's already left just recently last week, and we have one whose last week is this week. Huge hits, veteran workers, fully trained workers, leaving to go to work for another county department, with comparable qualifying, requirements, have the job at a substantially higher salary. A probation officer starting salary is about $12,000 more than a starting salary for a caseworker, and they both require a bachelor's degree. So we are, again, it really comes down to an internal equity issue. Very, very concerning. These are not my only vacancies for caseworkers in DSS. I have 5 additional. So with these 3 that I'm talking about right now, we have 5 additional that we have permission to fill. So that leaves me short 8 caseworkers, which is 32% of caseworkers in DSS, like 25.
That's a lot.
And then it just compounds. Like the issue is that I have 2 other caseworkers that were recently hired that are not taking cases yet because they are so new, they're still going through training. So when you add 2 on top of the 10, that's a 40% reduction in my caseworker staff that I don't have. We're in dire straits. We're doing everything we can to try to cover the workload. Of course, because we're down so many caseworkers, we've pulled our seniors from, they don't have anybody to supervise, so they're taking full caseloads. So that's helping somewhat, but it still does not bridge the gap.
I can't speak for the legislature, but it's fair to say that these particular staff and title might need to be looked at ahead of the collective bargaining negotiations that start in January. Because I know there was talk about some real good data about how our salary fits in with even surrounding counties or contiguous counties. And so I think Diane, that's on her radar, Diane.
And the last time that so this has been going on for a while. This has been on our radar for a while. And we worked to package up a presentation and information that we talked to the personnel committee about sometime in 2023. I think it was before the budget, before we started talking about the 2024 budget. So maybe it was June of 23, but at that time, we really did put together a lot of data around our numbers, what's happened to staff over time, why people are leaving, where they're leaving to, what the surrounding counties pay, our internal equity issues, because that is a reality. We are losing caseworkers to now probation, Office for the Aging, the Health Department. We've lost them to state jobs. It's not internal, but that's to state jobs, to the Auburn Community Hospital. It's been going on just constant. But so in 2023, we did package up that information. We had a conversation with Aileen, who was the chair at the time, HR. I think maybe Lynn Marinelli was there as the budget director. And at that time, so we really didn't go anywhere with it. I think that at that time, the CSEA contract was being worked on as far as the negotiations of that. But it's time to definitely do something. We need to talk about it again. I think something has to be done, or this is going to continue to happen. We have on top of salary issue, I mean, it's just a very, very difficult job. We have people that come in and they don't want to stay because it's not what they thought it was going to be. I don't know if there was a little more money, would that make them stay? I think, I don't know, but I think maybe we wouldn't lose folks to other departments that are here. Like losing these 2 to probation was just a huge, huge, huge loss for us.
I know they years ago upped the probation salary because what they were finding is similar to you. They would train people, they go through the training and the probation, the parole, they would leave to the state.
They leave
corrections counselor or parole.
Yeah.
So
So it is tough, and we have workers.
That really can't be done just by the department. You'd have to involve labor relations.
Right. And, you know, it's not as easy as just upping the caseworker salary either, because you have senior caseworkers and you have supervisors of the caseworkers that are pretty compressed. I mean, the compression issue is also a huge issue. When you start to tinker with one, it offsets the others, and it's just this kind of cascade. So it's definitely not like an easy fix. It has to be considered, all of that has to be taken into consideration.
I think HR may be coming and talking about commissioning the one that did the non-bargaining study, Capulet, to look at certain positions, the 911 supervisors, the 911 dispatchers. I know she's having a terrible time with the supervisors. Maybe it's the social workers, maybe the caseworkers, just to get us some good information about,
Yes.
the market. We're going to need it for negotiations too.
Yep.
But yeah, I think it's on people's radar.
Yeah. And I do think, and I'll stress this, we have that conversation, the internal equity has to be talked about, because the starting salary of a caseworker, you know, which is 52,500, may not be that far off the mark of surrounding counties. But when you have what's going on internally with other departments of the county, that's where we're losing them to. It doesn't matter what, you know, that the other counties around are pretty close to that. If you're losing them to make $12,000 more at another department, I mean, it's a huge issue. So today I'm asking for permission to fill one. And I'll be bringing in another resolution for 2 more next month.
Any other discussion? Hearing none, all in favor? Any opposed? DJ. And Human Services, using the help program position in Department of Social Services.
Second.
So this is a budgeted position that we have. We have a vacancy in the temporary assistance undercare unit. These are the folks that help with determining eligibility for different programs. The undercare unit are folks that are open. It's recertifying them, you know, getting information from them as it comes in when there's changes to their household. We're definitely, they're busy, looking for the fill.
We tend to have the same kind of movement problem with caseworkers and examiners that you have with the caseworkers in child welfare or preventative or.
We don't have the same problems filling the human services examiners. I mean, we do have, you know, we do have turnover there, but not the same way and not the volume at one time that we do with the caseworkers.
Any other questions, discussion? Move on. All in favor of 11?
Aye.
Any opposed? That carries. And finally, it is authorizing social services to produce 2 vehicles for the department.
Second.
Okay, so our Department of Social Services fleet of vehicles is 21. Our oldest cars are 2018s. We have 3 2018 vehicles, and they have somewhere around between, I think, 40 and 48,000 miles. We have one 2019 vehicle. I don't know the mileage on that one. In the past few years, we've had cars when we purchased cars, which we get 62% reimbursement on, by the way. We've had vehicles that are roadworthy still based on the motor pools assessment go to other departments. So we've had vehicles go to mental health to help them with cars that they need to transport folks or to for case managers and whatnot to drive. Parks Department took a car for last year that was that they needed. IT took one last year as well. And I think, I don't know if OFA.
The year before.
The year before took one. Took one. So we have, that has been successful. You know, with when cars come in, you know, the new cars stay with the department and then cars go out. And really, we do check in with the motor pool around what are the cars of our fleet that, you know, is there anything that should be taken off the road that's, you know, just not safe anymore? And then, you know, what are we looking at with cars? So we've gone by the oldest car as the cars to shift out into other departments. But yeah, so I think that we definitely have been on like a replacement type of like plan, with getting a few every year.
Seeing that movement toward looking at our vehicles and cycling them so that we don't ignore this process and we end up with a year where
Yes,
we're overwhelmed with requests
Yeah.
for vehicles. So this is,
yeah. We used to have years where we had 5 cars that were all, the motor pool started rusting out and they're unsafe and they won't be passing inspection. And, you know, we haven't had that in quite some time.
discussion on page 12. Hearing none, all in favor?
Aye.
Opposed? Page 12 carries. If there's no further business, oh, I'm sorry.
Can I just say a couple of things? I won't take very long, I promise. On house census, last Friday, we had 125 singles that were being housed by DSS and 34 families. So that's, again, stayed pretty stable over the last months. Not seeing a lot of movement up or down. I wanted to mention to you in particular, Elaine, you had talked about the respite bed utilization and I checked in and I'm going to get some more further data on that. But, my preliminary look at it was in January, it was 70% utilized. And you know, I think that's okay. And that's pretty good to my evaluation of it, because what that means is there's some flex for kids that are coming in and there's some anticipation that there may be kids coming in from JD court cases that need a place to stay instead of going to a detention bed, which can be $1,100 a day. Or give us some time to put them into the respite bed so we can find a place for them to go, a relative, a foster home. So it's never going to be, I would be shocked if it's ever going to be 100%. But, you know, having kids kind of coming and going and leaving some openings for kids that we know are in the pipeline. And I know that there's been some foster care cases that we've been concerned about recently because they have been very disruptive at the respite, or not the respite, the residential placements that they're in. And there's been consideration by the residentials to give us 10-day notice. And if that happens, then 10th day, we have to have a place for them to go. And if we haven't been able to find another residential for them, if that's what they need, then this is a place that they could go for a little bit. So it's nice to have that flex, you know, and it's nice to not use the detention beds that are so super expensive. And we also have to pay for transportation by the sheriff's department to bring them to Westchester. This is pretty.
Serving 3 in your mind.
Yeah.
Dragging.
Yeah.
But it makes sense.
Yeah, makes sense. I wanted to talk about caseworker vacancies and I did that. I don't have anything else to add to that other than I already said when I talked about the resolution. The last thing that I wanted to mention is, and put on your radar, is I'm very concerned about our inability to get another attorney, to get a social services attorney. We have not been successful in hiring our second attorney. We have our supervising attorney. We have a supervising attorney and we have permission to fill a social service attorney, and we have not been successful in, you know, having applicants come to the table.
And I asked if they were posting a salary and you said no, you were offering the job to an attorney with salary negotiable and you're still getting nothing.
Right.
Thank you, Madam Chair. I actually met with Brittany Massey, the governors today. We sat down together, we had a conversation about the strategies, box methods. We discussed, and I mentioned to her the idea of starting an internship program. We're looking for graduates from law school to come in and work under the supervising attorney while they get in the process of passing the bar. And we try to get people in that office to help relieve the stress off of her, and then hopefully maybe a few of them stay. It was interesting because her face lit up and I said, "Oh, what's wrong?" And she goes, "I tried to present this 3 years ago and it really didn't get any traction." So she's in support of this. It's kind of an idea. We've already set up with Diane to visit University of Albany Law School, Syracuse University Law School, University of Buffalo. We're also going to look at Brighton Strand, some other schools that have paralegal programs and try to do some recruitment as well. So this is something we are actively working on. Like I said, I met with her today. So we are being proactive in this. So.
Thank you. And or
Just to dovetail on what Christina said, the county attorney's office is experiencing the same thing. We are not finding any applicants. We did receive a bunch of applicants from Washington DC, from the activities in Washington DC. Most of those applicants, while they're highly qualified, aren't licensed to practice in the state of New York. So that's been a limitation that we've run into as well. The other thing we're noticing, and I don't have the numbers in front of me, is that the caseload in Christine's office between the custody matters, the visitation matters, and the open continuing Article 10 abuse and neglect is higher now than it was when we were brought in 2023, or I forget which it was, but the numbers are higher. And at that time, we had 4 attorneys. And now it's primarily Ms. Massey who's carrying the load, and Rich and I are also assisting. So the impact on our office and her office is still huge and almost unbearable.
I can give you those numbers. They're currently at 100 open cases. The cases they had prior, what Fred's described, was 87. Those numbers were provided to me today. So they have 13 more cases. Instead of 3 or 4 attorneys, they have 1. So you can see the caseload is the burden that she's carrying.
We do have the support. We have contracts with attorneys to help with guardianships, APS matters, child support, most of the child support, and the contracts. Thank goodness, because that definitely helps. But as far as like the active cases that are matters in family court, yes, they're around 100 and more coming. There's right. And there's a new family court judge, his expectations and things that he wants caseworkers to do as far as, on a case that's in before him, can be very directive. And, wanting certain things to be done to tend to the families that are before him with neglect matters. And, when we are strapped for caseworkers, that makes it difficult, but there's a lot of court.
Right. And 2 new petitions are coming this week. You've probably heard about that, but yeah.
Yeah, discoveries, orders. I mean, there's a lot of legal work within the Department of Social Services. So I welcome any help, support in trying to, strategize on the best way to be successful in getting folks to come here.
Yeah, we recognize that.
Thank you. And that was my last point.
Could you come with good news next month?
I do have good news, and thank you for saying that. And I'll just take one more minute, I promise. With all that I said about caseworkers and being down caseworkers, I am so proud of the staff. We had an audit, and I mentioned this a couple of months ago, that the state came in and did a review of our foster care, preventive services, and child protective services. And what they did was they took a look at a sample of cases, and they looked at the work. They talked to the workers, they asked questions, they read the cases, they looked at our court work, everything. And, then they use a tool to measure how we did against the standards. And the last time they came was in 2021. And, with everything that's been happening with being short on staff, we did better, than we did back then. And, there's always things that they find for us to work on, but, as far as getting out there, seeing families, assessing risk, offering services, documenting their efforts, seeing people within a timely period of time to assess safety, they did a great job. And, they work very hard, even with, the challenges of not having a building, and being displaced and, everything that came after COVID, everything that changed. I mean, they have done a great job. And proud of them for that. I mean, for sticking with it and doing a good job. So that's the good news. That is the good news to highlight for today.
Thank you.
And they're fun to work with, by the way.
They're fun to work with.
They, our our pride and thanks to your group.
I'll pass that on.
Workers, truly, truly. And they're doing life and death work. They are.
Very important work. Thank you.
Any other business to come?
I'd like to ask council a question.
Yes, sir.
The requirements for putting attorneys and staff, is it the same old issue or is it?
I'm not sure.
Are we not getting applicants and this is just for?
So anecdotally, a lot of law firms, bigger law firms are having the similar issues. So it's not just Cayuga County. This is also an issue throughout central New York. Do I think that increasing the salary range will help? Yes, but we're still not getting the applicants coming in the door, and that's the challenge.
Thank you. Sorry, thank you.
I do have. If, it's a little question for me as well. Are you finding that, you already know, are law school applicants and law school students down? Is this also part of a shrinking workforce and
I don't know the
baby
answer to
boomers
that.
have
Yeah.
dominated the workforce and now we have a smaller amount of people working in anything?
I don't know the answer to that. It's a good question.
One of the biggest problems is New York State does not recognize reciprocity. So if you're a certified in anything, EMT, police officer, lawyer, whatever, New York State doesn't accept outside state training. If you don't have New York State training, they don't want to talk to you. Because you have to go back and get their training. It hurts.
Any other business to come before this committee? Motion to adjourn?
Move it.
Second. Oh, adjourn, thank you.